So Ros, what I mean by that is, as I went through, because I've gone on there and I've looked for myself, because I think it's important that I see what's in it and what people are having to answer. So in having to answer some of the questions, I wasn't sure what they were getting at with a few of them. Like, for example, have you ever suffered a stigma when you've applied for a job? It's very difficult to know when you don't get a job. The reason behind it. And even if you ask an employer, for example, this is an example, even if you ask an employer, they're never going to say, oh, it's because you have a mental health issue that you've disclosed to me. So perhaps the way that the questions are phrased could have been tighter, perhaps in some instances. That's one of the issues that I identified. There are other issues that were identified. People have come to us and spoken to myself, to some of my colleagues. And even when I was reading it, for example, again, question two, the language it uses when it asks which community you belong to. So we have Arabic, we have, just as examples, white, and we have Hindu. Well, Arabic is a language, white is an ethnicity, and Hindu is a religion. So it's extremely confusing already as you're starting out and you're only on question two. So it doesn't bode well for the rest of the questions that are coming.
You said it was really important for these surveys to be accessible, inoffensive, relevant and clear. What do you mean by inoffensive? What did you find offensive about the survey?
I think it's that particular point. As you're starting off, you're just on question two. You're beginning the survey and you're filling it in at that point with the best of intentions to give the data. And you come upon this question, which is, apart from confusing, it can be quite offensive. I mean, some people just don't identify with any of those groups. And there is an other tab, which, again, I have found to work, but I have had people also reporting to me that other tab hasn't worked for them either. So they've clicked other and then been unable to actually submit it with the other. So what do they fall under? So it becomes extremely confusing and offensive to some as well when they start off and the questions are of that nature.
Now, you've raised concerns as well that this survey in its current form isn't going to generate the sort of result that the government is after without changes. So just to make it clear, you welcome the survey, but you do feel that there needs to be changes. Can you just take us through that?
We absolutely welcome the survey. Let there be no doubt. I mean, data is extremely crucial in order to make changes, and this is something that I said when we had the debate in Parliament on the mental health motion that was brought a couple of months back. And at that point in time, I did, if I'm not mistaken, mention the importance of data collection and gathering, and also stigma, the fact that it's no longer a taboo in our society, but mental health issues are there is a stigma attached to them, which is what this does. So we very much welcome it. But I do think that these glitches, perhaps they're glitches, but they need to be addressed in order to collect the best data that we can possibly collect in order to then impact upon the changes that are very necessary within our society to take things forward. It is going in the right direction, but I do think that the execution of the survey just needs to be looked at, and that language tightened, those questions focused on, and the answers teased out from people. And also the dissemination of the survey. Is this survey going to be disseminated not just online, because some people don't necessarily have access online? So perhaps if you've got a service user, so these are people who already identify with having a mental health issue, and they've gone to see a doctor, could perhaps that doctor invite them to fill in the survey or take them through some of the questions? And I think like that we're going to reflect perhaps the most vulnerable in our society, who are most affected by mental health issues and what they're experiencing. And I think that's crucial. So I do think we're on the right track, but some work needs to be done.